without Ion.
With the recent events in Buffalo, another mass shooting, many of our kids are certainly on edge.
So what can you do about it? Dr. Laura Saunders from the Institute of Living is here now to help. Hey, Doc, happy Wednesday.
Hello, friends, and happy Wednesday.
Unfortunately, our topic today is not a good one. Of course, it's another mass shooting, this one taking place in Buffalo, where 10 innocent people were gunned down, all because of race and hate.
Yeah. So is this something that, I assume the kids are seeing it, especially if they're a little older, they're seeing it on social media. Do you talk about it? Do you ask them about it? Do you try to shield them from it?
Well, so what we know is that from research, we've looked at the effects of racial trauma and how it leads to higher rates of depression and anxiety and stress. It's also been linked to PTSD, substance use, and other serious psychological conditions. So, experiences on racism, really, they build on each other and chip away at the emotional, physical, and spiritual resources of people of color and people who are targets of bias. There are other risk groups. So I really want our young people to be informed. Unfortunately, these kinds of events are becoming fairly common enough that it tends to flood our psyche and either overwhelm us and believe that bad things are lurking right around the corner, which is a hard way to live, or kind of dulls our senses and makes us numb and immune. So, I just worry about high levels of exposure to these kinds of things, and I worry about the effects of severe racism and radicalization.
Well, let's say your 8-year-old or your 9-year-old comes home from school and says, "Mommy, what happened in Buffalo?" What do you tell them? How do you even approach the subject?
So the next thing I generally ask in that situation is, well, what did you hear, right? So I want to find out what did they hear and then address any misconceptions or misperceptions or false information, and then try to stay as factual as possible without adding in a lot of additional kind of highly emotional content, because children are so sensitive to the emotional reactions of their parents. So the more you can convey information without a lot of emotionality, the better.
Okay. And you say it's best to limit the children's exposure to media coverage because it will just maybe cause more anxiety over something they have no control over?
Yeah, there's things that we do have control over and don't have control over. We sometimes have control. We do have control over turning off the TV and having endless amounts of information, and not always really the happiest of information. We don't necessarily have control over various events in our lives. So it's learning how to exert control where we do have it. And while I do want people, and young people especially, to have information, an overwhelming amount of information just tends to kind of numb people out.
Mm. You say reduce access to lethal means. Can you just talk more about that?
Absolutely. See, this concept is so critical, not just for people at risk of perpetuating violence, but reducing access to lethal means is the number one thing to do when you have someone who has vulnerabilities around depression and anxiety or trauma, because reducing access to lethal means that they will not use lethal means to harm themselves or possibly to harm someone else. Mm. So that concept is absolutely critical.
Well, especially you said if they're with the depression or anger, then their risk for using firearms the wrong way against themselves or others goes way up.
Yeah, and honestly, while, a lot of these incidents portray violence towards others, people with serious mental illness and serious and significant emotional vulnerabilities are far more likely to be a danger to themselves than anyone else. So I do not want to perpetuate myths that anyone with mental illness is a danger to other people. That is, in fact, not the case. They're far more likely to be a danger to themselves. So reducing access to lethal means is absolutely critical. And for some people, that means like medications and other kinds of things.
Yeah.
You also want us to remember that we're role models for our children, and what we say and do has a direct impact on them.
Right. And the more we espouse really negative attitudes or other things. I mean, hey, I grew up with a good amount of prejudice, right? And it took a lot of effort to overcome a lot of that. So we have to really be careful about the prejudice that we, as parents, perpetuate onto our children because they take up all that information. So it's just really being careful about the kind of information that we talk about or that we perpetuate, because we are absolutely role models for our children.
And as far as social media, I know this is a hard one for parents, especially the older they get and they're trying to keep track of it all. But you said you really should be watching, because sometimes teens and young adults are perhaps checking out radicalized sites.
So especially those individuals who carry with them emotional vulnerabilities, right? They are, I mean, and this, you know, some of these more high profile cases starting way back with Columbine, right, are very well documented. And so just being a little bit more aware of some of the information that your children and your teens and your young adults are getting access to, you know, looking for signs that they have seemed to have developed a belief system or set of beliefs that are really outside the range of typical and seem to be overly paranoid or negative. So it's just, you know, kind of being more aware. You know, it's the concept of, if you see something, say something, especially letting authorities know if someone you know is sharing online content that seems very violent or threatening. That's also very worrisome.
All right, we have like 20 seconds. Be kind to each other, right? Just be kind.
That is something we all have control over. The more you don't know what can happen, spread more kindness to the world. Be kind to each other.
All right. Thanks, Doc. We always appreciate your time.
Please take care.